To explain to this population about the effects of the endocrine system on reading capabilities, we'd use the tactile and auditory approach. In the case of a pituitary tumor, a half model of the brain would be used. This model would have the tumor emerging from where it resides in the pituitary gland. This would allow the individual to see and to feel the different parts of the brain and where the tumor lives. While this tactile approach is being used by the individual, we'd use an auditory approach to explain the reasoning as to why they got the tumor and what parts of the brain they are feeling. As for the treatments for a pituitary tumor, the brain model would still be used along with auditory speech. When explaining to the population of a surgical approach for the removal of the tumor, the brain model can be used to show how an endoscopic procedure would differ from a transcranial procedure. Speech would be used to go on to explain the use of radiation therapies and medications. As for take-home information, this would be done in the form of an auditory file and a visual aid consisting of pictures. When explaining to the population about diabetic eye disease, this would once again be done by the auditory approach. We'd explain to the population the results of an increase in glucose and its effect on blood vessels. To explain diabetes management for treatment to the population, an auditory file would be sent home so the population could revisit treatment and different management techniques.